Good day everyone! In this video, my partner and I are going to discuss a case in which an interdisciplinary approach between orthodontics and maxillofacial surgery was done to manage a midline diastema in mixed dentition. This presentation is entitled Achieving Your Best Smile Through the Synergy of Orthodontics and Maxillofacial Surgery, with a quote, Fusing Disciplines for a Smile's Ultimate Revival. In the realm of mixed dentition, the presence of a midline diastema can often be likened to a phase known as the ugly duckling stage in children. This condition raises concerns for both parents and children, making it crucial to ascertain the appropriate timing for addressing the closure of this developmental gap within clinical practice. The midline diastema manifests as a space between the two central incisors of the upper jaw and can be a natural part of the primary and mixed dentition, typically closing by the time the canine teeth emerge. However, midline diastema unrelated to the eruption of teeth has been observed owing to various etiologic factors such as supernumerary teeth, congenital absence of permanent teeth, deleterious oral habits, high frenal attachment, and others such as peg-shaped laterals and microdontia. Mischodens is a supernumerary tooth present in the midline between the two central incisors. It usually results in oral problems such as malocclusion, food impaction, poor aesthetics, and cyst formation. The prevalence of mischodens varies between 0.09% and 2.05% in different studies. Mischodens is considered to be the most common dental anomaly affecting permanent dentition and is rarely found in primary dentition. In 80 to 90% of the cases, it occurs in the maxilla, and half of this percentage are found particularly in the anterior region. The male population is more prone to be affected as compared to the female population, with a ratio of 2:1. On the basis of its morphology, mischodens can be classified as conical, supplemental, and tuberculate type, of which the conical form is the most prevalent. They may be erupted or in some cases remain unerupted and causes malocclusion. When dealing with midline diastema resulting from the presence of mischodens, it is essential to customize treatment approaches according to the specific dental condition of the individual. Mischodens, which are supernumerary teeth typically found in the midline region of the upper jaw, can exert pressure, resulting in a gap between the two central incisors. The treatment process typically commences with a comprehensive dental evaluation, which may include the use of radiographic imaging to accurately pinpoint and assess the mischodens. In cases where the mischodens is the cause of the diastema and is of significant size, a common course of action involves the surgical removal of this supernumerary tooth, and this procedure alleviates the pressure source and often allows the diastema to close naturally over time, frequently without the necessity for additional orthodontic intervention. Nonetheless, if the mischodens has been extracted but the diastema endures, orthodontic measures like braces or clear aligners might be necessary to bring the central incisors closer together and achieve the desired alignment. The choice of treatment will be contingent on factors such as individual's age, stage of developmental or dental development, and the severity of diastema. The treatment of midline diastema stemming from mischodens involves a combination of dental evaluation, surgical extraction when deemed appropriate, and potential orthodontic strategies to ensure the optimal alignment and aesthetic outcome. It is imperative for a dental professional to perform a thorough assessment and recommend the most suitable treatment plan for each unique case.
For case history, presentation of the preoperative images of the patient's smile at rest, wide smile, and side profile are taken, which are essential for documenting the initial condition of the patient's oral health. The image of the patient's smile at rest is taken to assess the baseline appearance of the patient's teeth when they are not actively smiling. The wide smile image helps in evaluating how the patient's teeth and smile appear when they are fully engaged in a smile. And the side profile image is necessary to assess the overall facial and dental profile of the patient. For case presentation, here we present an 8-year-old male patient reported with chief complaint of extra and rotated teeth in upper anterior region of the mouth. Intraoral examination revealed messy dents with 180 degrees rotated right maxillary central incisor. The patient had Engel's class 1 molar relationship. Radiographic examination ruled out the presence of any other unerupted supernumerary teeth. It was diagnosed that the messy dents caused ectopic eruption of right central incisor. Hence, it was decided to intercept the clinical condition by extracting the messy dents followed by space closure with the rotation of right central incisor.
For the treatment process of this case, it was diagnosed that the messy dents caused ectopic eruption of right central incisor. Hence, it was decided to intercept the clinical condition by extracting the messy dents, followed by space closure with derotation of right central incisor. After consent was obtained from the parents, the messy dents was extracted under local anesthesia and patient was called after 1 month for further treatment. Upon arrival, the healing of extraction wound was satisfactory. Derotation of right central incisor was started with brackets attached on labial and lingual side of the rotated maxillary right central incisor and on buccal side of first maxillary molar on both right and left side. Elastic bands were placed from labial side of the incisor to the right side of maxillary molar and lingual side of the central incisor to left side of maxillary molar. More elastic bands were placed on the lingual side so as to exert more force and derotate the incisor. Right side elastic acted as an anchorage. Patient was provided with elastic bands and was asked to change elastic every week, and instructions regarding oral hygiene maintenance were given. The patient was followed up every month for a period of 4 months. During this period, maxillary right central incisor derotated. Full arch maxillary anchorage was taken to avoid undesired rotation of the derotated incisor, the mesial migration of the molars, and for proper arch alignment. The patient was followed up for a total period of 8 months, at the end of which remarkable improvement in aesthetics was achieved. Post-treatment radiograph shows proper alignment of root of central incisors without any bone resorption.
Statement of clinical significance. To achieve ideal aesthetics, an interdisciplinary approach will be the best option for predictable result. The absence of an established classification system for diastema management prompted the creation of a novel classification that encompasses restorative, orthodontics, and periodontal procedures. In the realm of dental care, a remarkable transformation occurs when orthodontics and oral maxillofacial surgery join forces. This collaboration is particularly vital when dealing with the complex world of mixed dentition, where young and developing teeth demand special consideration. This pamphlet aims to introduce you to the powerful partnership that fosters the creation of beautiful, healthy smiles by tackling the distinct challenges presented by messy dents, those additional teeth that frequently emerge during a crucial stage of dental growth.